Well, welcome back to Scissors and Scrubs.
Mm-hmm.
We're still in shitty, cold, awful February.
It's torturous.
The only highlight is the days are getting longer.
Oh my God.
But they're staying fucking cold.
Freezing. I'm sitting there the other day and Sam was home and I'm looking into I'm sitting on the couch and I'm looking into my kitchen. I'm like, what time is it? He's
The sun's still out.
Like 4:35. I'm like, it was full sun. My kitchen and my dining room were in full sun. And I was like, look at how bright it is in here. And he's like, oh my God, it's 4:30. Look at how it's full sun in there. And he's like, yeah,
I said that to somebody the other day. I'm like, it doesn't feel like 4:30 at 2 o'clock in the afternoon anymore. It's starting to get night. And I'm like, this is how I get through my winter. Okay, it's Valentine's Day is coming or has already passed by the time this has happened. That's, to me, the last winter holiday. Now I can put my St. Patrick's Day stuff out. And that's green. And then it means spring happens in March. Not in New England, but the first day of spring is in March, which means we're getting longer days. And now by then, it's 6:30, the sun's going down. Lent has happened, which means the other end of Lent is Easter, which is in April, and it's going to be spring flowers. And after I put the St. Patrick's Day stuff out, I can put all my Happy Easter stuff out, which is all flowers. The daffodils, you'll see them in March coming out. It may snow on them, but they're coming out regardless.
It's just a sign of
random robin showing up. You're like, the birds are coming back. It's happening. It's happening.
One of the surgeons the other day was like, well, we've made it to February. I'm like, we have. And he's like, it's after February. I'm like, March. And he's like, yeah, but then spring. And I'm like, yeah. He's like, and then, after March, it's April, but then it's May. Yes. And then the boat goes in the water. I'm like, and then the summer is here. He's like, the summer.
And then before you know it, it's over.
Yeah. But I'm like, yeah. He's like, so like, I'm like, okay, we've made it to February. We're pretty much in May. I'm like, yeah, pretty much.
If January, February, March are marathon, March is Heartbreak Hill.
Yes.
Because you feel like it should be spring.
You're like, oh, we're there.
I should be able to put on cute little outfits, but no, it's still 20 degrees in March. And there could be that snow that comes around. I hate that month.
I hate March. That month. March is the worst. January takes forever, but March is the worst.
It's the worst. And it's still black and gray and brown in the whole world in a white. It's just, there's no color.
No.
I fucking hate March. It's long. It's 31 goddamn days. Okay, so anyway, that's not what we're talking about at all. But here we are in February, in the cold, shitty part of February. And we today are talking about... Laura's going to kick it off with a strange medical procedure that is helpful. And I didn't know what to do. And so I got into a rabbit hole and I just came up with strange medical procedures that we used to do and they made me laugh. So that's what we're going to finish with.
Someone actually wrote in about this they wrote in about something to do. I don't remember if it was like because someone was paralyzed and they had this procedure.
I've never heard of this.
I had never heard of it either. So I was like, oh, let me look into it. I was like, I've never heard of this or done it. So I think it's really cool. Anyways, I got this from the Cleveland Clinic. I'm probably not saying this right. It's the Mitrofanoff procedure. It's named after Professor Paul Mitrofanoff, who developed the procedure in 1976.
Oh.
It is also called appendicovesicostomy and continent urinary diversion. It's a procedure that allows adults and children with certain conditions to drain urine from the bladder through a stoma, usually in the navel or the belly button, without needing a urostomy pouch.
Oh, that's actually awesome.
It's awesome. During a Mitrofanoff procedure, surgeons use your appendix, because we don't need it, as a channel for urine. So one end is attached to a small incision in your bladder, and there's like a little tissue flap valve made of tissue to prevent leakage. As the bladder fills with urine, the pressure closes the flap, creating a one-way valve that stops leakage. So
literally ingenious.
So when your bladder fills up, it just automatically closes off, so it's not going to come out.
Right.
The other end of the appendix is sewn to a small incision in or right around your belly button to form like a stoma. So it's just a little hole, like right around
a Foley or something,
right around your belly button. If you don't have an appendix, they will use a small section of your small bowel, and then it's called a Monty procedure because someone else developed that. But it's the same exact thing. They will also make a small incision below the stoma to insert a suprapubic tube directly into the bladder. This is only a temporary catheter that drains your urine into a bag until your bladder and the stoma heal. Ureteral stents may also be placed at this time if needed to allow for the free flow of urine from the kidneys to the bladder. After the procedure, you will be in the hospital for 5 to 7 days. If ureteral stents were placed, you'll need another procedure 6 to 8 weeks later to remove them. The suprapubic tube will be removed in the office once the stoma is completely healed and ready for self-catheterization. Full recovery takes 3 to 12 months. Your provider will perform annual exams such as blood tests to check electrolytes, kidney function, and liver function, cystoscopies to look inside your bladder, kidney and pelvic ultrasounds, and KUBs, which are kidney, ureter, bladder x-rays. Mitrofanoff can be removed for some reason. If you don't need it anymore, if you don't want it anymore, whatever reason, the surgeon will simply remove the appendix and close both ends of the tunnel. And then urine would then be removed from the bladder by either having a urostomy placed, self-catheterization through the urethra, or urinating or leaking through the urethra.
That's crazy.
Yeah. Benefits of having one of these. It reduces the risk of urinary leakage or incontinence. It's easier to insert a catheter into your abdomen than your urethra. Children can perform this self-catheterization.
Yeah.
Yeah. So risks of having it, 2 out of 10 people need a revision surgery years later for stenosis or deterioration of the tunnel. And sometimes the stoma stops sealing after you catheterize.
That, yeah.
Because the appendix creates mucus, like your appendix always creates mucus, it does it even though it's in a new function, it's still going to create that mucus. So the tunnel needs regular irrigation to clear it out and help prevent bladder stones, because if that mucus sits there and it gets into your bladder, it'll make a bladder stone and then nothing can come through that. Saline is put through the tunnel by using a syringe, and then you suck it back out with a syringe until you're just getting clear saline back out. Irrigation, though, can affect electrolyte levels in your blood, and that's why they check your electrolytes every year. So why do we get a Mitrofanoff? In children, some children born with certain birth defects that lead to neurogenic bladder could have this. With children with congenital anomalies of the urinary system, like bladder exstrophy and cloacal exstrophy, which is when lower abdominal organs do not fully form and are usually kids are born with them on the outside of their bodies.
Oh, yeah.
So their bladder's not going to work right. You might not have a urethra. They can do this procedure so you can get the urinary bladder. Kids with CP, sacral agenesis, which is when part of the lower spine is missing, spina bifida, and spinal cord injury. In adults, you might get this procedure if you have bladder, prostate, or colon cancer. Severe urinary incontinence, like you'd have to have severe urinary incontinence, cystitis, MS or Parkinson's that cause neurogenic bladders, spinal cord injuries, or stroke. So I think the thing that we had seen was on someone who had, was paralyzed. They had a spinal cord injury, and they had this procedure, and they literally just sit in their chair, and they have a catheter, just like a catheter you put in your urethra, and they put it through their belly button. It drains you can drain it into the toilet, you can drain it into a bowl, you can drain it into anything. But it's not attached to you all the time, and it's easily, you can do that anywhere. You can do that in a public restaurant. You can do that at your friend's house.
And you have dignity.
Right. And like a kid can do it because it's not going through anything painful. When you put a catheter in your urethra, I mean, if you're paralyzed, I guess you don't feel it. But if you have these other things, you're going to feel it.
If you didn't paralyze, it'd be awkward to get in position.
Yeah, because you can't just do it sitting up straight. You know,
if you're a guy, maybe.
I mean, but still, it's you have your penis out and doing it. You know, like this, you're literally just putting it into your stomach, releasing the urine, taking it back out, and that's it. I think it's like the greatest thing. I'm like,
I can't believe I've never heard of it.
I've never heard of that. And I'm like, I think it's like such a great.
We've never done it. I've never seen it done.
I have never seen that done.
Yeah, it's kind of cool.
I think we should ask some of the urologists about it.
I think we should.
Like, hey, have you ever seen this or done this? Or, but I think it's like ingenious that they thought to do that.
And that somebody did it and succeeded in doing it.
Yeah.
Well, Laura, these were some fails. These were some epic fails. Okay. Some are like treatments, and some are medications that didn't work so well. And one of them would be a milk transfusion.
Ew.
In the late 19th century, milk was believed to be the perfect substitute for blood. Did you know that?
I'm sorry. The late 19th century? So the late
like
1800s.
Yeah. And that the fatty oil quality would become white blood cells. Mm-hmm. However, while a few instances of this procedure were successful, many resulted in death.
Yeah.
In one instance,
you can have a milk embolus.
The injection of milk dropped the patient's pulse immediately to the point where they had to be resuscitated with a combination of morphine and whiskey. They lived 10 days after the operation.
Resuscitate people with morphine.
Whiskey.
And whiskey.
It's an old-fashioned. We're going to throw a little morphine. Yeah. Cigarettes. I'm pretty sure my mother read this article and thought cigarettes were going to cure her because she smoked for 110 years. So it's showing you in attached that a relief for hay fever, asthma, and rose fever, cigarettes.
Oh.
It's common knowledge that now they do the exact opposite, but at one time they believed that cigarettes would cure asthma. Dr. W.A. Evans reported that in an experiment conducted by researchers Parkinson's and COVID, the subjects became breathless on exertion. Some have pains around the heart, some have palpitations, and others suffer from a swimming head. So even though they advertised this treatment, they knew that it was already not going to be good, but they were still promoting it. Soothing syrup. Mrs. Winslow's soothing syrup was a popular remedy for babies experiencing anything from teething to diarrhea. Mm-hmm. So what was the secret ingredient in this 25-cent cure-all? A heavy percentage of alcohol and morphine is the answer. No wonder why the kids were soothed. No. They were fucking unconscious.
We're going to just make you pass out.
Later on, this soothing syrup, along with others, was condemned. They were labeled baby killers. If you value your child's health and life, never use any of these preparations.
Can you imagine giving them that?
No, 25 cents a bottle.
Wow.
Well, my father-in-law, God bless him, every remedy his parents ever gave him involved
whiskey.
Like blackberry brandy, whiskey, like here's some vodka. Like, all these kids were fucking shit-faced. Here's your teeth, rub whiskey on it. No. Okay. Chloroform. Oh. This was believed a cure for asthma. Yes, because you're fucking
Why are we gassing people with asthma?
This claims that one treatment with chloroform completely relieved all symptoms of asthma. It also had you stop breathing. The belief would eventually result in the deaths of patients who had overdosed during an asthma attack.
Yeah, because you'd be take more.
Yeah, so they have a little clipping of a newspaper. Death was accidental. Finding of coroner's jury in case of Mrs. Pearson. Overdose of chloroform.
Oh my God.
It had been taken to relieve pain following a very severe attack of asthma. And she died. If the cigarettes didn't work for your asthma or hay fever, cocaine might.
I mean, pretty sure that might.
The thing is, you're going to be really running around now, so that asthma might get agitated. You're going to feel fucking great, though. Many believe that allergy symptoms caused by pollen could be alleviated with the application of cocaine.
Why haven't I been using cocaine my whole life?
This was discovered not to be the case. Dr. George Frederick Laidlaw, a recognized leading pathologist of homeopathic school in New York, is quoted in multiple articles saying, if you can't cure it without cocaine, you'd better keep the hay fever. I don't even know what that means.
What?
If you can't cure it without cocaine, I guess he thinks you shouldn't be using cocaine. This is an article from somebody who used it. Whitney's head buzzed with the excitement of this thing. I bet it did.
I mean, cocaine is medicinal.
Yeah.
We do use it medicinally.
It couldn't explode your heart. Just ask Len Bias.
Yeah, but we used to put it in the nose.
Yeah, we did it to stop bleeding.
Right. That's what I'm saying. There are medicinal...
It's a vasoconstrictor.
Right.
Which there. You pinpoint eyes.
Are medicinal purposes for cocaine.
Medicinal
hay
uses.
Hay fever is not.
No. To stop, and even now, we don't do that anymore. You can't find...
No, I haven't
When
seen
I started in
cocaine
94, cocaine were on
They were in the drawers.
Yeah. You could get cocaine. Yeah. Apparently somebody was abusing that.
You didn't have to sign it out. It was just in the drawers.
Yeah, it was just in the drawer. It was in the plastics cup. Yeah. The Whale Hotel. This is from 1899. Reports on a hotel in Australia where you could go for rheumatoid arthritis. You're going to love this one.
What?
In this treatment, whenever a nearby whale died, patients could be rowed to the whale. Then the whale would be cut up and a narrow hole made in the body. The patient this is like something right out of Empire Strikes Back. The patient would then lay down in the carcass for around 2 hours. Imagine the smell.
They're floating in the ocean in a dead whale.
Yep.
For their rheumatoid arthritis.
Well, Laura, it allegedly relieved soreness and inflammation, and this may be the best part. It was reported to be discovered by a drunken man who was staggering along the beach near the whaling station at Twofold Bay, and who, seeing a dead whale cut open, took a header into the decomposing blubber. I would read the article, but I can barely read. I can barely see it. Yeah. Could you imagine going to the whale hotel?
How? Why? Because it was soft
oily,
and warm?
It's oily? I don't know. I don't know why you would do it. Who would? I don't know.
Can you imagine smelling like dead whale blubber?
Could you imagine getting in it?
No.
Could you imagine how bad that smelled
Even
being in it?
Just that, but I'd be afraid, like, I don't know, what if it
rolled over and
now
killed
you're
me?
stuck in dead whale
Well, I'm
under
sure
the
they
water.
had, I mean, it was the whale hotel. I'm sure they had practice with
Probably.
this. Okay. Katzenklavia. And I'm adding this one because there's no record of one being built. The theory was shocking to me as a cat father. The Katzenklavia would have the cats in a row with their tails stretched out behind them, and a keyboard fitted out with sharpened nails would be set over them. The struck cats would provide the sound. A fugue played on this instrument when the ill person is so placed that he cannot miss the expression on their faces, and the play of these animals must bring Lot's wife herself from a fixed state into conscious awareness. So they were doing this for unconscious people.
What
They
were
were
they doing?
basically, it sounds like they were taking nails and hitting the cats with them till they meowed. And then the cats would start like screaming, and it would wake people up out of unconsciousness.
Well, that surely would. Have you ever heard a cat scream?
Here it is. That's a picture of it. So they're in little pens, and their tails are being hit by the nails, and they're all screaming.
God.
And that's what's waking people up from comas.
Just let me go.
The cats don't look very happy.
Keep me in a coma.
Yeah. Yep. Well, I think I'd go with the smoke enema.
Oh.
Tobacco smoke enemas were considered a successful treatment for cholera.
For cholera?
Mm-hmm. They were recommended as an alternative remedy to opium. I'd rather the opium.
I'd rather the opium.
The exact procedure varied, and in some instances, a pint of boiling tobacco-infused water was administered into the intestines. You know why it killed cholera?
Because it killed everything.
Because it killed you.
Yeah.
Could you imagine pumping boiling water into your intestines?
Boiling tobacco water.
It's boiling water. You'd singe them.
So they're just shitting themselves is what they're doing. Because the tobacco is just going to make you go to the bathroom.
Hundreds of lives might have been spared if it weren't for the tobacco enema. Because it apparently had been killing people. Boiling hot tobacco water up your ass.
And you're literally just going to shit.
But all your intestines are coming
burned.
with it. And you're already like compromised because cholera, you've been shitting yourself for days. Okay, this was my favorite.
Oh my God. Who thought that? Why would you think that?
They'd have you eat mercury for syphilis. Or inject mercury up your hoo-ha for syphilis.
But he says like, oh, this might cure syphilis. Have some mercury.
Some nut job. These people didn't
But
have
who
real
thinks,
medical...
let's put tobacco in boiling hot water and then
and
put it up
your
your
ass.
Why?
Ouch is all I can say. All right, so this was one of my favorites. Vibrators. They'll cure your hysteria.
I bet they will.
Yeah. 19th century doctors to thank for the introduction of the vibrator, which was first advertised as a cure for catch-all female disease known as hysteria.
Mm.
Hysteria was believed to cause any number of maladies, including anxiety, irritability, like anything women had, irritability, sexual desire, insomnia, faintness, and a bloated stomach. Every basic
people are
PMS
PMSing.
syndrome, was hysteria.
And we were locked up for it.
So almost every woman showed some symptoms.
I should probably be locked up for mine.
The condition traced its roots back to the ancient medical theory about wandering wombs, where a displaced uterus caused females ill health. My womb just wandered around in there and made me get hysterical. So what was the treatment for this? A pelvic massage that would induce hysterical paroxysm. He'd give you an orgasm.
Oh my God.
This job labored with Victorian doctors who manually massaged the women. But in an effort to spare the doctors this work, one ingenious practitioner named Dr. Joseph Mortimer Granville created a steam-powered electromechanical medical instrument named the manipulator.
No.
This device allowed women to give themselves home massages.
I did.
They weren't getting it from the Vermont country store, apparently. No. He gave it to them directly. And allowing them to cure their wandering wombs.
Wow.
It actually had a picture of...
I'm afraid.
I don't have it with me. I don't know what I did with it. I had a picture of it. It looked like a belt sander. I'm like, I don't know, how, like, what was... Maybe it was like... I'm going to say this. You're going to look at me like I'm out of my fucking mind. But you ever see an old shoe shine box? And you ever see the buffer for the shoe? It's this real, like, sheep's wool, but it's real soft. Yeah. It almost looks like that was what had been on the top of it. Yeah. Oh, tickle. So yeah, he came up with the first vibrator, so the doctors didn't have to do it. Can you imagine the doctors being like, "Yeah, come here, we're gonna take care of that wandering womb.
Let me give you a pelvic massage."
Wow. You know what? I was gonna talk about fen-phen, which was ephedrine, and it's 1996. Where am I in 1996? I'm living in California. And we in the United States, I'm just going to tell you my little fen-phen story. I'm not going to get into it. We in the United States had already outlawed fen-phen because it was ephedrine. Mm-hmm. And my girlfriend and I went down to Mexico, and they have pharmacies everywhere, and they were selling fen-phen. So she buys like 5 boxes of fen-phen because she tries every weight loss diet here. And I had just bought a cute little leather bag. So she puts all her fucking fen-phen in my bag with her 2 bowls that were shaped like guitars that she bought down there too. So we're going across the border. Who gets stopped at the border for fucking fen-phen and 2 pot bowls? Mm-hmm. I did. Mm-hmm. Yeah, I did. Yeah. And the guy's like, literally, you carried your friend's shit. I'm like, I did. I wasn't thinking anything of it. He's like, give me the fen-phen and get the fuck out of here. I'm like, okay, just don't arrest me. Yeah, that's fen-phen. I'm not going to get into it. Yeah. Heroin, the cure for a cough. You ever watched The Nick on Cinemax?
No, everybody tells me to.
It was a good show. It was a good show, but he got addicted to cocaine. I'm having a stroke.
Codeine.
Do I have rabies?
You might. You're sitting there, Mike.
Cocaine. He was addicted to straight up cocaine. Bad. So they put him in a rehab. And like the last scene of the season is he gets up and he's, wow, I thought it'd be worse than this. And they're like coming to give him his medicine from Bayer, and it's fucking heroin. He's like, I love the treatment. Yeah, I bet you do. How do you cure one drug epidemic? You create a new drug. That's what happened in the late 1880s when heroin was introduced as a safe and non-addictive substitute for morphine, known as diamorphine. It was created by an English chemical researcher named C.R. Adler Wright in the 1870s, but it wasn't until a chemist working for Bayer Pharmaceuticals discovered his paper in 1895 that the drug came to market. Finding it to be 5 times more effective and supposedly less addictive than morphine, Bayer began advertising a heroin-laced aspirin in 1898. God, this is the only time I wish I was living back then. I'll tell you what. They marketed it towards children suffering from sore throats, coughs, and colds. Some bottles depicted children eagerly reaching for the medicine, with moms giving their sick kids heroin on a spoon. Of course they were reaching for it over and over, and then using the spoon to heat it up, and then injecting it. Doctors started to have an inkling that heroin may not be as non-addictive as it seemed when patients began coming back for bottle after bottle after bottle. Despite the pushback from physicians and negative stories about heroin side effects piling up, Bayer continued to market and produce their product until 1913. Wow. And it wasn't until 11 years later that the FDA banned heroin altogether. Lobotomies.
I mean, Tylenol and codeine, it's pretty much the same thing.
Yeah.
And I had that for a cough. Yeah. The whooping cough. That's what they gave us. Teenagers, they gave Tylenol codeine.
When I know, I had it for my...
No, Phenergan with codeine. It was the cough syrup had the codeine in it. Phenergan with codeine.
Got my tonsils out at 19, and I had codeine with Tylenol. And my mother refused to give it to me because she didn't want me to be addictive. Mm-hmm. And if anybody's had their tonsils out, they will know how fucking painful it is. My mother absolutely refused to give it to me. It's not a good time. So heroin, was probably something else. I'm trying to stop my car, and it's not doing it. All right, so lobotomies. I actually listened to a podcast about lobotomies. It was fascinating. Because they would do it like for women with hysteria. Let's just fucking lobotomize them. Kids who were on, ADHD or whatever, they'd lobotomize them. And it was thousands and thousands and thousands of people. And they talked about Rose Kennedy, her daughter, Rosemary. Yeah. That they had put her in a convent they were hiding her away, basically. She was probably in her early 20s, and they wanted to do a run for some office, and they didn't want her embarrassing them. So she was a little slow, but she wasn't, today you wouldn't have thought twice about it. And they said, well, they were doing the lobotomy on her. She was reciting like the Our Father and then all of a sudden she stopped talking and she never spoke again. Yeah. And she was basically a fucking vegetable. Well, so
yeah, I mean, it's
terrible. It's absolutely terrible. Lobotomies, hacking away troubled brains. Something else that I was fascinated with after watching One Flew Over the Cuckoo's Nest. They gave him a lobotomy. Walter Friedman thought he'd found a way to alleviate the pain and distress of the mentally and emotionally ill. Instead, he created one of history's most horrific medical treatments. Mm-hmm. He developed his procedure, which became known as the prefrontal lobotomy, based on earlier researches by a Portuguese neurologist. Early versions of his cure involved drilling holes in the top of his patient's skull, and then later evolved into hammering an ice pick-like instrument through their eye sockets to sever the connections between the frontal lobe and the thalamus, which he believed to be the part of the brain that dealt with human emotion. Freeman soon teamed up with James Watts, and after practicing on cadavers, they performed their first procedure on a live patient in 1936, a woman who suffered from agitated depression and sleeplessness. She was probably in menopause. Mm-hmm. It was deemed a success, but subsequent surgeries were not. Patients were left in a vegetative state, experienced relapse, and regressive physically and emotionally. As many as 15% died. One of the most infamous victims was Rose Kennedy, who was left incapacitated and spent the rest of her life needing full-time care. He was as much a showman as he was a doctor, traveling to 23 states to demonstrate his miracle cure. In all, he performed 34,000 lobotomies, some on patients not even in their teens yet. And despite the obvious risk and lack of concrete success rates, hospitals willingly let Freeman continue, perhaps because lobotomized patients were easier to deal with. Mm-hmm. Everything changed in 1967 when he performed a lobotomy on one of his original patients, a housewife living in Berkeley, California. This time he severed a blood vessel and she died of a brain hemorrhage, finally putting an end to his brain hacking.
Thank God.
I mean, we're going to stay on this trail and we're going to go with shock treatments, the cure for impotence.
Oh. Yeah. I was going to say shock treatments actually do work, but this is a different
not for impotence. The medical profession has had varying opinions on the causes and possible cures for impotence. The repressive Victorians honed in on a man's moral weakness as the cause for genital dysfunction. And by the 19th century, impotence was thought to be caused by either an excess of sex or masturbation or too little of it. You had to have that fine balance of just enough masturbation and sex, but not too much.
Mm-hmm. No,
not enough.
Too little. It's like Goldilocks.
Surgeon Samuel W. Gross noted in his book, Practical Treatise on Impotence, sterility and allied disorders of the male sexual organs, masturbation, gonorrhea, sexual excess, and constant excitement of the genital organs without gratification would lead to impotence.
Oh my God.
What would be constant excitement of the genital organs without
blue balls?
Satisfaction, but constant? Like you're getting blue balls? What is this guy?
Like you get...
He can't control himself.
Yeah.
Some doctors introduced galvanic baths or bathtubs filled with electrodes that were supposed to restore, that didn't fucking kill you, were supposed to restore sexual desire in just 6 sessions. Others took an even more localized approach where rods with currents running through them were placed inside the man's urethra. How does that feel, Mike? The treatment would last for 5 to 8 minutes and would be repeated once or twice a week. This was thought to be practically helpful for those with significant atrophy to the genital.
Oh.
They're frying his balls. Where a buck can be made off an insecure customer, the quack doctors and unsavory businessmen are sure to follow. By the late 1800s, ads were running for electropathic belts or electric belts aimed at weak men.
Wow. Weak men.
They claimed to help cure kidney pains, sciatic nerve issues, backaches, headaches, and nervous exhaustion. But the underlying message was they would cure men's sexual problems.
Wow.
And that, my friends, is some of the weird shit
that is weird.
We did.
Mm-hmm. Very weird.
Electric rods.
I'm surprised by that because usually, women get all the horrific treatment.
Yeah. But men will try anything, I guess, to get what they need.
That's true. They weren't taking their brain out because of it. So
you got what I need. All right, so we got a couple of emails to go out.
Well, I got one. It's from Jesse. I'm listening to the IVF episode, and first off, ew. Not that I'm looking to date, but God, what a way to get turned off of dating. That's terrifying. Especially because Vegas is a melting pot from every damn where. But also, that episode was fascinating. Thank you for that. Digressing from the point of my email for a moment, that cat scratch fever segment reminded me of a story about a friend of mine I thought you may enjoy. He was playing with one of his cats and it scratched him. Not bad, but enough to draw some blood. He didn't think up much of it because cats do that, but apparently his skin was icky and sweaty from his Apple Watch, and the two things, being so close, led to him almost dying. He got super sick and his arm was covered in a gross red swollen blob. Ugh. He ended up in the hospital with a severe blood infection. 1 operation, some weeks of OT, and an epic scar later, he's okay.
Wow.
But it was a wild ride. The doctors didn't exactly know what nasty bug ended up being responsible for the infection, but did eventually link the cat scratch and the sweat from the watch, and I think came up with some variety of staph. A staph infection will kill you real fast.
And 100%.
Mm-hmm. He and I went through surgery, OT, recovery around the same time because I had horrifically broken my arm, and it was nice to have someone to commiserate about it all with. I'm happy to share the arm story if you're interested. Yes, we are. LOL, I even have crunchy CT pics. Anyway, Sarah's story reminded me of that.
We don't need the crunchy CT pics.
I mean, now that I've talked your ears off, the whole point of me writing was I was going to suggest an episode of just y'all sharing your ridiculous stories from the OR. I love when you plop them into other episodes when they relate, and I'm sure I'm not the only one who wants more. Everything from that doctor that no one wanted to work with because he was mean as fuck, to the crazy, icky, or wild illnesses or injuries. If you can share them, we'd love to hear them. Hope y'all are staying warm and causing all the chaos. Have a great week, Jess.
Well, we'll see what we can come up with for you. I mean, we did have that first one. That tapped a lot of our stuff.
I know.
But it has been 5 years, and we do see some weird shit.
Yeah, we'll have to go over it.
Yeah. The newbies coming in. They've been fun.
Well,
our orientees are always fun. They always give us good stories.
Yeah.
All right. Well, it's still freezing. We're not warm yet. And hopefully by the next episode, it will be March. We'll be almost in spring. And that will make me very, very happy.
Oh, please.
And my nail guy will be back so I can get my St. Patrick's nails. That would make me happy too. Have a safe trip, Andrew. So that's it. That's all we got for you. I hope you enjoyed these episodes, and we will see you in a couple of weeks. Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.